We go now to our reporter, Laura Windsor, on assignment.
Bedwetting is an issue that millions of families face every night. Usually it's not a sign of any deeper medical or emotional issues, and kids eventually grow out of it. Dr. Tony Khoury of Children's Hospital of Orange County offers parents solutions for their child's bedwetting problems.
About 15% of children age 5 wet their bed. And that statistic decreases by 1% per year over the next 10 years. So that by the time the child is 15, still 1 to 2% of them are still bedwetters. And in adults, surprisingly, and that's something that most people don't talk about 1% are still bedwetters occasionally. Let's be very clear. Bedwetting is not really a disease. It's not an illness. Bedwetting is just a step in development that hasn't completed.
Dr. Khoury describes the treatment options.
The two common ways to treat it are by medication or by wetness alarm. I personally don't favor the medication. What the medication does, it's a medication that turns off the production of urine by the kidneys. Well, the kidneys is not where the problem is. The problem is communication between bladder and brain. Still, a certain percentage of these children will urinate in bed, will bedwet, even with the small amount of urine that the kidneys manage to produce despite that medicine. The better solution is a behavioral modification, is a biofeedback system. Whereas we put a little pad in front of the child's underwear. As soon as the child begins to urinate at night, a buzzer goes off, wakes the child, and by doing that process repeatedly for 3 to 4 weeks, it takes about 3 to 4 weeks for the brain to realize that it's not keeping track of the bladder at night. And that biofeedback system allows the bladder and the brain to talk to each other in the background at night, the same way they do it in the daytime.
Dr. Khoury tells us the success rate of wetting alarms.
The statistics with wetting alarms are excellent. Within 3 weeks, about 75% of the children manage to respond to the alarm initially, so it goes in phases. At the beginning, they wake up as they're wetting, and then they wake up just before they're about to wet, just like anybody who sets an alarm for school sometimes wakes up before the alarm goes, and then they sleep through the night. And we suggest that they continue to use the alarm for 6 months continuously after their last wet night. Again, bedwetting is not a disease. Their kids are the smarter kids in the class. Give them lots of encouragement. Reassure them that this is something that will stop spontaneously. Don't push your child to stop wetting unless the child is really motivated. Most of the time it's the parents that are pushing and the child has no interest whatsoever. And so they don't react to the alarm. They don't wake up. It's not their problem. It's mommy and daddy's problem. The one other factor that has really made a big difference today is that pull-ups are so good these days, and they're so dry that the kids don't mind being in them. So back off, or if you really want your child to be irritated by it, take them out of pull-ups, put them in underwear, and make them responsible to A, to do their laundry, B, to change the sheets, and then it will aggravate them, and maybe they'll be more interested in being dry at night.
Using effective solutions for your child's bedwetting problems can mean a restful night's sleep for everyone. I'm Laura Windsor for the American Health Journal.